Welcome to SIA Conversations. जैसे कि आप सबको पता है, SIA Conversations are for creating a narrative and trying to understand what's happening in Pakistan, what's happening in Pakistan society, economy, etc., etc. तो मेरी जो कोशिश होती है, it's always been that I get the best people in Pakistan and hear their stories and their ideas. कि कुछ लोग हैं जिन्होंने काफ़ी कंट्रीब्यूट किया, बहुत कंट्रीब्यूट किया सोसाइटी को, और वो भी करी जा रहे हैं, और उनके आइडियाज़ हैं जो हमें शोकेस करने चाहिए, जो हमें बताना चाहिए कि उन्होंने क्या क्या किया है। जो मैं बार बार कहता हूँ, जो मैंने एक और वीडियो में भी कहा था, कि हमारी सोसाइटी बड़ी वो नाशुक्री है। हम अपने जो अच्छे लोग हैं उनको रिकग्नाइज नहीं करते। तो अनफॉर्चुनेटली ये वो सोसाइटीज डेवलप नहीं करती जहाँ ऐसे बात ऐसी 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 सिचुएशन हो। Today I'm very pleased to present to you Shahnaz Wazir Ali. I don't think that she needs any introduction, but let me just briefly say, Shahnaz has been, mashallah, associated with education, the social sectors, in many different forms. She's been a major politician. Let's also not forget that. She joined the PPP, and she has been a leading member of PPP through BB's days, through Zardari's days, and to date, I think she's still with the PPP. She's run educational institutions. She's run the American School in Lahore, a very important institution. She's also running BISP now, which is a very, very important university. And I think she's devoted the last 10 years or so or more to BISP. And BISP has really climbed the ladder in terms of the rankings and is doing a good job. So thanks, Shahnaz, over, very important job. उसके बाद शहनाज बीबी ने ये भी किया जी कि इन्होंने वो अगर किसी को याद नहीं तो बीआईएसपी की जो ओरिजिनल फाउंडर थी ये थी। इन्होंने बीआईएसपी को सेटअप किया। वो कैसे इवॉल्व हुआ वो भी बात करेंगे, बट बीआईएसपी इन्होंने सेटअप किया, इस पर उसको बहुत बड़ा इनका हाथ था, तो उस पर भी इनको हमें खराज तहसीन पेश करनी चाहिए। उसके अलावा इन्होंने पाकिस्तान सेंटर फॉर फिलैंथ्रोपी भी सेटअप किया, जो एक और इदारा है जो सारी एनजीओज वगैरह को लुक आफ्टर करता है। तो और फिर माशाल्लाह शी इज़ बीन associated with many educational reforms and committees and thoughts on education. She was on, I can't recall, she was on many, many committees, many forums, jahan education ki. So you can't think of education in Pakistan without talking about Shahnaz Wazir Ali. So Shahnaz Bibi, let me just say thank you very much for joining us. Let me begin by asking you to comment on all these things that you've done. First, your brief life history, more than what I've described, whatever you want to say. Then we'll move on to each subject. Thank you.
Thank you very much, Dr. Nadeem, and Assalamu alaikum to everybody who's listening in. It's really an honor and a privilege to have this conversation with you. I think there are many people in Pakistan who have contributed very significantly to the education sector, and I just count myself one amongst many. But since we obviously have to be focused on the time, and I hope it will be time of value to anybody who's listening, my interest and my connection and my commitment to education actually started very early in my life, and it started from my home and from my parents. So I'll go back to the year 1949. I was just about 4 years old in 1949. And my father was in the government service, and we were living in Karachi. My mother had always been very keen to do something useful in her life and for society and for Pakistan. And of course, at that time, the commitment levels and the emotional levels and the sentiment for a new country was so high and so completely absorbing. And many people I think, started and laid the foundations for many big institutions that later emerged. So I was ready to go to kindergarten school, and there really were no schools around the area, in the neighborhood. And she decided, and my father encouraged her, and he kept saying to her that, why are you looking for somebody else to educate children? Why don't you start yourself? Each one of us has a responsibility. So ye kehte hue, my mother was very encouraged, and she had gotten herself a BT. In those days, there was no B.Ed, there was a Bachelor of Teaching. And we had a government house which had, I think, 2 bedrooms and a large hall type of place, and a corridor, veranda, where she cleared out the minimal furniture that we had. And I still remember that classroom. And that's how I started my education. That's about An initial group of 8 or 10 other children from the neighborhood also joined. So really in our home, all the time, education was a very principal topic of interest, concern, commitment, and activity. So from that time onwards, those 10 children grew to 20 and then 30 and 40, and my mother involved some friends to come in and do voluntary teaching. And by 1950, she established the trust, the Education Trust. And that's one of the oldest trusts for education established in Pakistan post-partition. And she and her brother, my mamu, who was a lawyer, he drafted the deed. Until today, the Education Trust runs schools in Karachi. And it serves the children of low mid-income families. I'm a trustee, and I've been a trustee for over 35 years. And so my major commitment in life, which has stayed throughout, ever since I was made a trustee and ever since I came back from university. I came back in 1964 from Washington after receiving my degree from the American University. My father was posted at the embassy, so I had that opportunity to be educated there. And by 1967 or so, I was appointed a trustee. So 65 years or something, that's the connection. And that's where I learned my lessons about education, in the classroom, in the field, with the children, with the parents. And the first experience I had to, which I treasure always, and I'll tell you a lot of development terminology that I learned much later. And the big programs, the World Bank programs, SAP1, SAP2, USAID, at that time DFID, now FCDO, etc., all come from some fundamental experiences that I've had in my life. So, Nadeem, I'll be very quick about that. So that's the foundation of my commitment to education, is the Education Trust.
So, yeah, बताइए, then can I just butt in here and ask you? You've been associated with education in Pakistan. Are you happy with what you achieved? And if you're not happy, which I suspect you're not happy,
no.
What is your?
Okay.
बोलिए.
I think it's an area of probably the highest concern for anybody who wants to look at Pakistan's progress and development, who believes in equity, who believes in human resource development, human capital as a critical area for development. All of us know that the education sector, like whether it is provision of water, provision of housing, provision of jobs, health facilities, and all of these areas, Pakistan is still struggling. We're just struggling 67, 68 years later, or 77 years later. So what were the lessons that I learned in my early years before I even went into the political party, People's Party, of which I'm still a member? And I'm proud to be a member of the Pakistan People's Party for some of the very major and significant initiatives that we have taken, both in health, like the Lady Health Workers Program was also a People's Party initiative, fundamentally designed by me, but guided from day one by Benazir Sahiba's commitment to the provision of health at the doorstep. So it was a preventive program, primary healthcare programs. Similarly, polio and other immunizations. So with I have three, maybe, let me just quickly pinpoint them and then we can go more into detail. So, your education knowledge comes from different sources. You may be at a university, you may be teaching schools, you may be an analyst, a development specialist, but seeing the ground reality is what really teaches you the lesson more firmly embedded in your mind and your consciousness and your ethics. And my first lesson that was taught to me was when I came back from university in 64, I went to the school and I said, I want to teach, or you please give me a nice position in the school. And my mother said, absolutely not. She said, you have no experience, go and work in a public sector school. So Nadeem, my first public sector school experience was in Lyari. It was, I can't remember the name of that school, but it was something like 243 or 342, I don't remember. लेकिन वो स्कूलों के ऊपर नंबर होते थे. पुरानी सी बिल्डिंग थी, उसमें 3 कमरे थे और बत्ती भी नहीं थी. There were no fans, there was no lighting, there was no lights. There was a wall which had very, very rough and uneven black paint on it and a few pieces of chalk that the teacher had used. But the children were sitting in the street outside. They were sitting on the dirt a little narrow strip next to which was open sewage. And that's the school I went to teach in Pakistan. And I was there for 6 months. And so I understood a lot more. We talk about multi-grade teaching, there it was. We talk about inadequate provision, physical facilities, etc. It was all there, and there were many, many schools like that in Karachi and in many other parts of the world. So where are we today? If you look at the data indicators, there are still thousands of schools without adequate physical facilities. They don't, apart from the fact that they don't have bathrooms and drinking water, which is absolutely critical, the conditions of the schools today are just appalling in many places. This is not to say that effort has not been made and that there are no well-constructed government schools. There are. But the scale is so large, on the basis of which you need to run a system which is public sector. So my experience there today, it is as clear in my mind as anything. Training of the teacher there, there was no way she could manage, even on multi-grade. So the other big component is teacher training and development, which is all about quality. And where are we today about quality? You've read the ASA reports, the Annual Status of Education report. That is a reflection of the efficiency and competency of teachers, that if children's learning outcomes are so poor, which they are, as you know, this is Dr. Bela Jami's report, which talks about the fact that if you test grade 4 students and grade 5 students, they're 2 to 3 years behind their counterparts in other parts of the world. They're learning at very, very low.
Question needs to be asked, is 80 years not enough? I mean, look at countries that have made progress in far less time. Look at China, it was far behind us, it's made up. And Vietnam, despite a war. So where does the failure lie? Why can't we make up? Why are we constantly, I mean, I'm also getting very old, but all my life I've heard about out-of-school children, about quality of education, teacher training. I remember, in fact, my earliest memory is my aunt getting teacher training. So how have we failed? Why have we failed?
I think you know very well, and I've heard you speak on many occasions. And I think really it's a heart-rending sort of situation. I mean, clearly, without my saying it, everybody knows that policy commitments and rhetoric never translate into real reform, deeply embedded, rationalized reform in the education sector, as this has not happened in many other social sector areas. Once again, I say, if you look at health, if you look at water, if you look at women's rights, women economic empowerment, etc. So why doesn't it happen? There's not one single politician who will stand up and say he doesn't believe in good quality education. Every one of them says that. But the competing priorities for the limited resources of government, which are financial and fiscal resources, just do not allow us to pitch. I mean, we talk about 4% of GDP as an indicator of a global minimum level. And we've been talking about this for 30 years. I mean, this is a UNESCO figure that was put out close to 30 years ago. And what are we pitching there? 0.8% to 1.2% and maybe 1.4% of GDP. That's what's been the range of percentage of GDP that we spent. So clearly, the fiscal resources are very limited. But I'm not underlining that as the first problem. I feel that when you look at what are our resources, you look at all of society's resources. You can't look at solving a big problem like good quality education for all our children just by budgetary resources of the federal and provincial governments. There is society out there. Society is doing so many things. And society, I mean, civil society organizations, individuals, groups, philanthropists, committed people who have just rolled up their sleeves and said, we are going to pitch in for education. So out of that, you get the public-private partnership model. You get the stipend model. You get the contract out model. It came rather late in the day. Perhaps if we'd done some of these things earlier. So why haven't we been able to do it? Because it is still not number 1 or 2 or 3 or 4 priority of government. And it doesn't translate into action. And also because the well-to-do people and the elites never sent their children to public sector schools. And there are multiple categories of Pakistanis. The well-to-do, islands of wealth and prestige and privilege, and then a middle class, which is still not as large as it should be for a developing nation, and 47% of our population below the poverty level. How can they do anything? So the scale, I think, Nadeem, one is commitment. Now that's, it's all rhetoric. I don't want to say it again. Why doesn't commitment translate? Because really the system of patronage, the system of privilege, and the system of political power is such that education doesn't give you a quick result and an early win. If you do something about education in your school or in your district, it doesn't buy you votes for the election.
There's एक चीज तो हो गई ना जी, universities जो हैं, for example, every politician wants to make a university in his district. And we are making universities like there's no tomorrow. We've got 260 universities and very few professors. चले वो तो ठीक है. But let me ask you another question. कि ये जो हम बात कर रहे हैं, for example, teacher training. Teacher training, as I said, I've been hearing about it all my life. My aunt was getting teacher training when I was 4 years old, and I still remember that, picking her up. But the other thing that we've done over the years is we now have one of the largest private school systems in the world. In fact, I think, I'm not quite sure, but the number of students in private schools may be now higher than the public schools. So we quite frankly worked on a privatization model. And as you know, I'm a very big fan of the private sector. But in this case, I'm a little worried. And there are several people, for example, like Author Diane Ravitch in the US, who was the Assistant Secretary for Education. She's written a wonderful book on this subject, and she criticizes the privatization of education. But that's a separate point. But now, one thing that's come across, do we need teacher training anymore? We've got the Khan Academy, we've got the internet, we've got students. If we give everybody a tablet and forget about teacher training and just take the network, is that not a better way to give kids education?
I mean, clearly in every society, and also in ours, there's no question. The person who's got to deliver the education has to be competent and trained. I mean, I don't see that one can just relegate it to the sidelines. But how to do teacher training? What is the content and quality, and how do you get that outreach? Remember that when we talk about education, it's not about the big cities. In the big cities, over 90% of the children are going to private schools. Low income, low fee charging private schools are the largest intake of low income household children. Think about the schools in the remotest part of Pakistan. To me, the policy should be developed keeping the most remote, the most marginalized areas in our focus. Only then can we begin to address not only the problem with one prescription, there have to be multiple prescriptions. On that, I feel very, very clearly. How do you get to the remotest schools in Balochistan is not how you're going to get to schools in Punjab, in the center of Punjab, which is a big industrial belt where access is easy. So how do you even get to those teachers? People say technology kare. Khan Academy. बहुत सारी जगहों पे मैंने देखा Khan Academy के initiative शुरू हुए. We are part of it also at the Education Trust Nasser School. But in places where there's nobody to even, I mean, there's no electricity. They don't have cell phones. Yes, we have a high density on cell phone, but not in remote areas. They don't have access to computers. So I think we depend too much on the phone and say, here's. So IT-based solutions are part of the solution, not the solution.
Okay, then the second question that I have is, while you were speaking, I just Googled something. I just Googled the relative salary of a teacher relative to the rest of the population and results in schools. And I find a very interesting comparison. Where teacher gets respect, like Finland, for example, I'll just read it out to you. Finland has pays its teachers 120%. 97%. Germany pays its teachers 125%. South Korea 140%. So countries do respect their teachers and pay them. In Pakistan, I find that teachers are paid, even in private schools, they're paid less than government schools for a start. Government school, I just found out, pays about 1.7 million per year, which you can imagine, which is like, what would it be, like 40,000 a month or something, which is very small, right? Even less. And private schools pay even less. So could this be a situation that we do not have a teacher respect approach? We don't respect our teachers. We treat them as the lowest of the low. But more importantly, I think the education department runs our education. Would you be with me? I favor this thing that, like Trump has closed the Department of Education, we should close the education department everywhere and let the school be independent. Let universities be independent. Let the headmasters or whatever principals or vice chancellors run their universities without interference from the bureaucracy. Would you agree with that or not?
You know, there have been many prescriptions that shut down the department, reorganize the department, decentralize the department, and so forth. I'm not a believer in shutting down the Department of Education or of Health or of Population Family Planning. However, the departments definitely need to be majorly restructured and reformed and be led by specialized people. Because education is a particular area of expertise. It is not a generalist's job. Not the secretaries. I think you must have seen the data. How many times, on average, secretaries are transferred? Across the board, whether it's in Sindh or Punjab or KP, very high transfer levels. So the tenure of the person and the person who's actually leading the department, he's there for 2 years, 3 years. How do you reform anything on a national scale? I mean, we're a country of 250 million people, out of which 71.2 million are children of school-going age. 71.2 million, Nadeem, is equal to about 6 countries in Europe. And you have, let's look at provincial secretaries of education, because they're really in charge of delivering schools and managing them. You need somebody to be there, a good, qualified, well-informed, technically well-qualified person to lead reform for a good 5 to 8 to 10 years at least. Even 5 years in my book is too short. So I wouldn't shut the departments down, because fundamental responsibilities of the state. It is a fundamental. Now, the how you do it is the question. Should government provide schooling for all? It cannot. It has shown it cannot. So therefore, it has to have multiple different models. And there are multiple models. So where are the bureaucrats who are trained to deal with partnership models, public and new initiatives? So a multiplicity, to me, I think it's a very long discussion, but what I will say is that you've got to have multiple initiatives to address the multiplicity of the actual landscape in Pakistan, from the mountains to the deep, or rather the enormous mass of desert-like geography in Balochistan, to cities, to South Punjab, interior Sindh, remote KP, and so on and so forth, and then the mountains regions. So आप एक strategy नहीं इख्तियार कर सकते. Now, who's going to do that? Our education departments do just, it's like a stamp, you put a stamp and think everything's going to happen. It's not going to happen. We're a multilingual, multi-ethnic, multi-social structure society. Somewhere tribal societies are powerful. I mean, the tribal leadership is powerful and determines. In other cases, there's an urban landscape. So, I think this needs a longer discussion, but I think that we really need to have government dealing with multiple initiatives.
Okay, so another question. We've had multiple initiatives and many reformers like Michael Barber and many people coming here and telling us education will be fixed next year, and we've had many programs, Padha Likha Punjab, etc., so many things. Education has been a political slogan. Again, all these programs, how do you think? Is it our implementation that failed? Is it the design that failed? Was the money insufficient? Because we've had many loans for education. What happened? I mean, somehow I think education is to me a very amorphous subject. वो गुम जाती है चीज कि सेक्रेटरी साहब हैं, फिर डायरेक्टर हैं, फिर डिपार्टमेंट डायरेक्टर हैं, फिर सेक्शन ऑफिसर है, फिर ये है, फिर वो टीचर तो बेचारा वो जाके नीचे कहीं आता है, और फिर टीचर को आप ट्रांसफर कर देते हैं, फिर टीचर को आप you treat him as an election agent. Quite frankly, we are also confused. And I frequently, I'll tell you what I do. I'm sure you appreciate that, Kiji. When I go to my friends' children's education, marriage, most of them are married now, but when I used to go there, I used to ask this question, where are the teachers? And my friends would get mad. Why are you asking this? I said, yeah, I mean, these guys, the teachers educated them. Where are they? So as a society, we also don't respect teachers, right? When I go to any conference or seminar, I don't see the teachers. I see the donor consultant sitting there. So please tell me, what about the design? And does the design involve the teachers, or does it get stuck in the superstructure of education? Because we've got a very large superstructure of education.
Yeah, we do. Well, you've raised various points, and I just want to refer to the comments you made earlier about the teacher salaries, government teacher salaries. The governments have increased teacher salaries significantly over the last couple of years, which is a very, very good thing. It should have been done much earlier, but you pay a teacher a much higher salary. Headmasters in schools today get 75,000, 80,000, and somebody who's been there for so many years is drawing a fairly good income. So teacher salaries by no means are low compared to the rest of the economy and the other jobs in Pakistan. I'm talking about the typical government school teacher salary, who's out in Badin or in Lodra or in Karachi or places like that. So government has done a couple of things, and there have been initiatives. So let's look at what has been possible and where something has succeeded. You know, when Shahid Kardar was heading the Punjab Education Foundation, he started a stipend program to ensure that the retention of girls in particular and the transition from class 5 into secondary school, class 6 and onwards to secondary school, was maintained. In other words, kids didn't drop out after class 5, and particularly girls didn't drop out. That has been such a successful initiative. And Punjab has implemented it, and the results are there to see. So certain things can be done. I think they placed 250 rupees in the hands of the family and the girl so that they could actually get that stipend, and that was the motivation and said, अब वो 250 से बहुत ज़्यादा हो गया. अभी भी Punjab Education Foundation में अच्छा program चल रहा है. Second thing that I think government has done, and you referred to Sir Michael Barber, I was the co-chair of the task force with Sir Michael Barber. Punjab adopted a lot of what the Michael Barber and the committee, there was Dr. Akmal Hussain on it, Shahid Kardar on it, and other economists on it, and other development sector people and educationists. And we worked very, very hard. We worked closely with government to actually see what were the actual facts on the ground. Prescriptions are not hard to find. So there have been improvements. It's not that everything is bleak. In Punjab, the way teachers are recruited, in Sindh also, now the teacher licensing system, the teacher recruitment system has shown improvement. In KP, definitely. School management, school-based teacher availability, attendance, and classroom outcomes have shown improvement. But it's not sufficient. It's not enough. So let me quickly identify a couple of initiatives in Pakistan. I'm now just talking public sector. And before we talk about initiatives in the public sector, I'll talk a little bit. I think everybody knows it who's listening into this podcast. Pakistan has basically, I would say, 4 streams of education. I'm now not talking about the A-level, O-level, but that's one stream. Clearly, it's identified. Those are the private sector schools that deliver it, charge high fee, give good facilities, good teaching. But a very small percentage of our children go to the A and O-level schools, and it's an external qualification. So there's the public sector schools, which are also 2-3 subsets Public sector schools like the federal government public sector schools in Islamabad with nice buildings, nice gardens, well-paid staff, good libraries, science labs, etc. And then there's little school way out in Rahim Khan or in DG Khan, etc. That doesn't have it in the remote areas. So there's 2-3 categories of public schools as well. Municipal schools bhi hote hain, city government schools वगैरह bhi hote hain. But nevertheless, this is that whole mix of public sector schools. Then there are madrasas. And today in Pakistan, by the latest numbers that I was looking at over the last couple of days, there's 43,000 plus madrasas in Pakistan. And they have their own boards, their own curriculum, their own regulation, and their enrollments have increased multiple times in the last 20 years. So there's a huge madrasa system, which is not often studied well enough to know what is the quality of teaching. But we know this for sure, that the large madrasas have adopted, they've got computer labs, and they are teaching computer sciences, but they're not adequately teaching math, physics, chemistry, algebra, and geometry, that bundle of critical subjects. So there's the madrasa stream there, and then wo bhi bate hue hain, Deobandi bhi hain, Barelvi bhi hain, farak qism ke madrase, different sects have their madrasas. 2-3 categories of government schools, and in the government schools, I will also put the military cantonment schools. The Air Force has its own very, very nicely run schools. So does the Army, garrison schools, large areas.
Cadet colleges,
And then you have the private sector, which also has several subsects. Low fee charging, middle level fee charging, for profit, not for profit, and then the high fee charging schools. So even today, walk down any gully or street in any big city, and you will find schools, mohalle mein jo schools khole hue hain, 2-3 kamron mein, jo 800 rupees fees charge karte hain. And in the same city, in 10 minutes, you can get to a school that's charging 40,000 rupees a month. So how is government going to manage all this? You just can't. The market is making certain decisions and making certain services available. So when you were talking about what has been happening, why not task forces, committees, commissions? How many times have we declared an education emergency? So what are we doing about this?
Exactly.
So there are initiatives. Look at CARE, look at what SIA has done, look at TCF. We have some of the world's finest models, finest. Can it go to scale? Obviously, it cannot cover all the children. So yes, why can't there be more TCFs? Why can't there be a more supportive environment for more TCFs, more CAREs, more other such initiatives that can actually deliver at only a certain scale? It cannot take over all the children of a province. So I think that the issue is here, not just money, it's management. It's how do you use society's resources and bring them together. And now, of course, IT and technology is very much there. So, but to me, technology is not the whole solution. We know that Mehboob is doing a wonderful job with his knowledge platform, absolutely amazing. Salman Academy is coming in. There are other people working on IT in Pakistan. And it can do to a certain level. It can provide some access, information, and teacher training. And we are not even doing that at the scale that we probably could. So you need more imaginative people. You need people who can take the initiative and political leadership that gives the space for multiple initiatives and decentralization of certain education sector decisions.
I think that's the operative word, decentralization and good management. जैसे मैं यदि अमेरिका में रहता हूँ बड़े साल you know that for example I've seen there's a school superintendent for every not city but every county, every locality, and the school superintendent runs the district, and there's a school board made of parents that run the education system. But then the schools themselves are very, very autonomous and very independent. And there are a variety of schools there too. And those schools run by the government, private sector too. Well, the private sector is much smaller in the US than here. But वहाँ डाइवर्सिटी पेज ऑफ, एंड आई थिंक डाइवर्सिटी यहाँ भी जो है अच्छी बात है, इट शुड पे ऑफ। हम कोशिश करते हैं डाइवर्सिटी को मारने की और इसको यूनिफॉर्मिटी मिलाने की। वी डोंट रिस्पेक्ट डाइवर्सिटी एंड एक्सेप्ट कल्चर। बट एक और भी चीज़ है जो एज एन इकोनॉमिस्ट मैं देखता हूँ। एज एन इकोनॉमिस्ट मैं देखता हूँ रेट्स ऑफ रिटर्न टू एजुकेशन, एंड आई सी कितने थोड़े रिटर्न्स हैं टू प्राइमरी एजुकेशन। प्राइमरी एजुकेशन के रिटर्न्स वर्चुअली निल है। एक दफ़ा मुझे एक ड्राइवर ने कहा था लॉन्ग टाइम अगो कि आई वोंट एजुकेट माई किड, the reason being that he's going to become your driver. And you want a driver to read your road signs. I don't want to give you a driver to read road signs. So the question is, education has to be a vehicle for social mobility. And as you can see, I use this example all the time and people get mad. If my driver is well educated and I'm going to Synth Club for lunch, and I tell my driver to sit outside with a copy of Dickens and read it, doesn't make any sense. Then he has to go into Synth Club with me. But we have such a stratified society. And the point is, एक और चीज देखने के जो पाकिस्तानी educated kids हैं, I've been researching this recently, they will never become heads of banks. It's only city bankers who are foreign educated who become heads of banks. जो भी situation है उसमें यही है कि there is a certain social capital associated with getting key positions. And that social capital comes from Eastern College or from grammar school or from the various places that you go to, foreign university, etc. We haven't built a system to compete with the rest. So जब हम कहते हैं out of school children, I wonder, I mean, is the parent just deciding here, what's the point of giving my kid an education? He's never going to catch up. So I might as well not send him to school. So how do we deal with that problem, the economics problem? I mean, as I keep telling people, did my PhD with the guy who wrote the book on education, Gary Becker, and his whole point was education is an investment, and we educate our kids to get a return. So it's literally like buying a bond or a stock. But if you're giving me a bad bond, which is a poor quality education, why should I send my kids to school? So this problem को हमें confront करना है. How do we confront this problem? Because we look at education from the point of a social good. So social good तो ये है कि फिर we have to subsidize that education very well. मतलब huge subsidy देनी पड़ेगी because the kid can also earn something.
Yes, we look at social rates of return to education.
Social
And the equation and the formula tells us that if a society invests in education, which means not just access, it's not just expanding the school system, but it's giving reasonably good quality education to our children.
What about the private returns?
Well, private schools are a very small percentage.
No, private returns. Sorry. There are two returns. Social returns are for kids being educated in a society and return to society as a whole. Private return is where I get educated and the return is to me. So private returns both low. Social returns to high, private returns are very low.
Absolutely. I mean, we say that what is the transformative agent in society? Education is the transformative agent. It can change lives. It has changed lives. And with education, they can move from one social economic strata to the next one. Absolutely. 3 or 4 things here, Nadeem. What I have found, that this myth that we've always perpetrated, that large sections of Pakistan's population are not interested in educating their children, that the majority of the poor are not interested. They don't want to send their girls to school. That's absolutely wrong. It's fallacious. It's some, I don't know, it's a way to delude yourself. They all want education. Even in tribal societies, remote areas, बहुत conservative areas में पाकिस्तान में, किसी घर में चले जाएं, चाहे वो सरदार साहब भी उधर बैठे हों, वो ज्यादातर majority कहते हैं कि हमने बच्चों को educate करना है और बच्चों को भी educate करना है. तो एक तो जो myths थी ना that determined our policy and our policy responses and our operational responses, they really need to be laid to rest. Similarly, like they say, people don't want family planning. And I want to connect a couple of things here. There is today close to 40% unmet need for family planning. Couples of reproductive age want smaller families. They want family planning. We are not able to give them the services, quality, easy accessibility, and safe family planning services sufficiently across the country. So to get back to education, yes, absolutely, the private rate of return is very, very high. Let me give you, once again, I come back to scale. There are today 71.26 million children of school-going age between the ages of 5 and 16. That's a huge number, which I referred to earlier, 71.2%. Of this, about 47 million children are in school, are enrolled in school, all the schools, of which girls are 48% and boys are 52%. So, okay, these are macro numbers. What are the real numbers? Real numbers are attrition, how fast they drop out of schools. This talks about the fact that parents don't want their kids coming to school because the schools are not teaching them anything. So they want their, the school has to be a magnet. It has to be a magnet of something relevant and useful, so it becomes an economic, plus point for the family to send their child to school. So we are not doing that. It's not about just physical access. It's about quality. If you establish schools where teaching takes place and teaching of value takes place, then children will come. You will have over-flooded schools. Families will send their children to school. So we've tried all sorts of crazy prescriptions. Food program shuru kar dein, meal program shuru kar dein. They've been abject failures. हमारे स्कूल में पानी का नलका नहीं है, पानी पीने के लिए नहीं है, आप खाना कैसे वहां पे पका के बच्चों को देंगे? और ये imported solutions, ये nutrition packet, World Food Program दे रहा है. आजकल आपको पता है how many hundreds of thousands of children across schools and children across Pakistan getting nutrition packets, because suddenly when the nutrition report came out, everybody was staggered. I mean, didn't we know before the report came out how many children are suffering from malnutrition? And malnutrition leads to cognitive retardation. तो हमारे बहुत high percentage बच्चे हैं जिनकी malnutrition की वजह से they just cannot even learn. This is what we've done. It's a crime that is being committed every day.
But let's discuss it this way. Let me just ask you this question. Supposing now, People's Party might come in again or whatever, it doesn't matter. Whoever is in power, doesn't matter. Supposing you're given the full charge of education in Pakistan to design the best policy you can and see it implemented, what are the key things that you would do? How would you depart from the past?
Well, let me say this. Look, I'm talking about the problems because we started talking about what are the issues. Why don't things improve? And therefore, and once again, I will go back to saying that in many cases, governments have done certain things which have brought about a certain percentage of improvement. But sustaining it, improving it, reforming it, and collecting the data, looking at the outcomes, and keeping it maintained at that steady system of reform to cover scale. These are the issues that are the problems. Ab Sindh government ne 3-4 bade अच्छे steps लिए हैं. Health sector में Sindh government ने इतनी improvements दिखाई हैं. I don't want to go into that. There's another area. We really should interview somebody on that. On primary health care, on tertiary health care as well, on the lady health workers model being improved and also strengthened and so forth. So things have happened because health and education are linked. The health of mothers and health of children and education is linked. And family size is linked. Poverty is all about family size, essentially. So when you continue to grow at the rate that we are going, and we are one of the highest growth rates in the world country, so ye sari cheezein what I would suggest for anybody who is still looking at doing something vital, first of all, this multi-sectoral approach has to be represented in an interconnected sectoral departmental arrangement. Education sector separate silo mein hai, primary health care separate silo mein hai, or family planning separate silo mein hai. So the leadership at the top, I know you can't merge all these departments, but the policy leadership at the apex, and once again I say Sindh has done it. Why has there been improvement in the health sector in Sindh and better family planning outcomes? It is because there is one minister. So for public for health sector and for family planning. Now, if there was what you would call a triumvirate, in a sense, or a core committee of at least 3 ministers, actually I would say 2, 1 minister in every province, 1 minister for health and population, connect them, and 1 minister for education. The 3 of them, it has to be a joint policy strategic approach. So that's one thing, definitely that needs to be done. The second is, of course, multiple models of teacher training. And once again, I would say that there have been some very good results accruing from the cluster-based field out in the remote areas, cluster-based teacher training. Because these teachers cannot be brought into major cities and live there for 6 months or 8 months or 10 months in the year. ये खवातीन हैं जो ज्यादातर प्राइमरी स्कूल्स में पढ़ाती है, अपनी फैमिलीज को, अपने बच्चों को छोड़ के वो 6-6 महीने कहीं और नहीं जा सकती टीचर ट्रेनिंग के लिए. और हर टीचर के सामने कंप्यूटर स्क्रीन नहीं है, डेस्कटॉप नहीं है कि वो ऑनलाइन टीचर ट्रेनिंग करे. ठीक है, जैसे अल्लामा इकबाल ओपन यूनिवर्सिटी भी है, but that's really not the answer. So you go to them. The teacher training system has to go to the field. They cannot be imported into big buildings, pipes, Pakistan, provincial institutes of teacher education. I would say make district institutes of teacher education and sub-district institutes. That's where the government at the district and sub-district level needs to invest. Why can't teachers from 20 schools or 30 schools in a particular area go to a tehsil-based teacher training center? हमारे पास नहीं है, अभी भी नहीं है. तालुका बेस्ड टीचर ट्रेनिंग इनिशिएटिव्स नहीं है. क्यों नहीं है? क्योंकि जो स्कूल है वो तो तालुका और डिस्ट्रिक्ट के साथ कनेक्टेड है और तहसील के साथ कनेक्टेड है. तो बहुत सारी चीजें डिस्ट्रिक्ट बेस्ड एडमिनिस्ट्रेशन, ऑपरेशंस एंड डिलीवरी. I mean, I'm just abbreviating it. Similarly, for learning materials. I mean, why is it that teacher transfers and anything to do with the school and the request goes all the way to the provincial headquarters? And Punjab, again, has done something very good. They've separated the education secretaries. और सिंध में भी ये किया है. हायर एजुकेशन का सेक्रेटरी और है, जो कॉलेजेस और यूनिवर्सिटीज वगैरह देखता है, स्कूल के सेक्रेटरीज और हैं. मगर ये हो सकता है, मुमकिन है. Government structures need major reform, and the staffing of these ministries, departments, education, health, and family planning should be done by experts. The old colonial model does not fit us any longer. How long are we going to stick with what the British colonizers left with us 80 years ago? A generalist administrator. वो district commissioner बेशक रहे generalist administrator, but education is a very specialized area, as is family planning, population welfare, and so forth. So I think these are the 3 or 4 things that one needs to do, and support private sector initiatives. So wherever they are unit cost effective, quality outcome effective, support them with, as they say in the business sector, ease of doing business. How about ease of delivering educational outcomes? Why don't we have a cell? Where's the support for public-private partnerships? And it is definitely more cost efficient. It is definitely more efficient in giving you outcomes. Although I am not advocating is सारे private sector schools better outcomes देते हैं for the lower income bracket, because nobody is there to help them and assist them. So it's a very large private sector out there. 47% of all Pakistan's children in the urban centers, even more than that, in fact, go to private sector schools. Karachi's enrollment figures tell you, and so do Lahore and Multan and Faisalabad and big cities, Dr. Nadeem, that more than 86% of children are in private schools in big cities. So there can be better partnerships. There can be a lot of things that can be done. There is no special initiatives department. IT ke liye nahi hai. IT, again, I would say IT is a partial answer, but let's at least maximize that partial answer. We are not doing it. So these are the things that I would look at. I'm not even touching the whole area of curriculum. What do we teach in our history books? How relevant is the curriculum? How effective it is? Multilingualism का बहुत बड़ा मसला है. अभी तक mother tongue instruction पे नहीं हम आए. I mean, every single educationist around the world, and evidence shows, first couple of years mother tongue instruction. सिंध में तो होती है, लेकिन again काफी training नहीं है teachers की. So governments ने initiatives लिए हैं. GB is a wonderful example. Go up into the northern areas, go and see what Gilgit-Baltistan is doing with its regular schools and its community schools.
They've done very well. Yeah, they've done very well.
Hunza में, Gilgit में, घांची में, दियामीर में, आप कई जगहों पे जा सकते हैं और देख सकते हैं. In the KP province, in the last couple of years, not the recent years, but prior to that, I would say that education reform, school reform, was effective because they had decentralized to the district level. So there are things that you can do. If you were to become education minister, I hope you will do them.
Of course, Ji. Now let me go to the other areas that you mentioned. आपने ये बड़ी अच्छी बात की कि जी development as a whole has to happen if people are really involved. We try and deal with slivers of the human being. कि जी educate कर लो, forget about the rest. But I think it has to be multi-sectoral, as you said. So you developed the lady health workers, which, as people note, is a very successful program. But unfortunately, वो politically भी up and down जाता रहता है because funding की वजह से. So please describe to us what the thought was behind the lady health workers. And what did you hope to achieve? Have you achieved it? And should it evolve to another level? And how should it evolve to another level?
Okay, so let me give you a little bit of background for lady health workers. When Mohtarma Benazir Bhutto and I, not only I, but the policy working group on social sectors, which I coordinated for her when she came back in 1986, she established that policy working group at that time. When she was preparing, actually for the 88 elections, although we were not able to do that much, the core idea of large-scale outreach for primary health care, maternal care, and child care was there. If you look at that manifesto of 1988, it has a core idea there, but it's not adequately fleshed out. So in the 93 to 96 term, and we'd had that time in between, we worked a lot on what do we do about the health sector outcomes. So the health outcomes were really appalling. Even at that time, for years and decades, Pakistan has had appalling outcomes on child health and maternal health and so forth. So clearly one of the things that came out was that the fixed facility systems that Pakistan has in the health sector, आपको पता है सबसे पहले एक डिस्पेंसरी होती है गांव के लेवल पर, उसके बाद एक बेसिक हेल्थ यूनिट होता है, एक तालुका हॉस्पिटल, तहसील हॉस्पिटल्स भी होते हैं और फिर डिस्ट्रिक्ट लेवल हॉस्पिटल्स होते हैं, लेकिन जो बेसिक फिक्स्ड फैसिलिटी यूनिट होती है वो बेसिक हेल्थ यूनिट होती है. तो पाकिस्तान में आई थिंक 8,000 something like that BHUs, more than that by now. And how do people get to the BHU? The target area for BHU is many kilometers. So एक खातून है, she's pregnant, needs delivery, needs to be attended. She can't get to the BHU. Basically, midwife attend करती है. सारी midwives trained भी नहीं थी. So we looked at this whole issue of primary healthcare services and immunization. And it was more than clear, crystal clear. I studied the example of South America, where they had what was the equivalent of the barefoot teacher in China. They had barefoot doctor, barefoot health worker. So we took that model and refined it for Pakistan, and out of it came the lady health worker model. It is still the largest program virtually in the world of its type, which is an outreach for primary health care for children and mothers, maternal and child care. And the first base was 10,000 female lady health workers. And we wanted very rapidly to expand that to 20,000. And when we hit the 20,000 mark, we were going to add the male health workers. And nobody talks about that much. Because without the male health worker from that community, from that village, गांव है, गोट है, किली है, जहां से भी लेडी हेल्थ वर्कर उसी इलाके की थी, उसके साथ एक मेल हो तो एक्सेस टू द हाउसहोल्ड ज्यादा बेहतर हो जाता है. तो हमने वो जो अपने माइलस्टोन्स और टारगेट्स बनाए थे, and as you know, both the terms of Mohtarma Benazir Bhutto Sahiba were cut short by illegal and unconstitutional dismissals of her government. And so obviously a lot of things could not come to fruition. But the lady health worker today is, I think, 132,000 or so across the country. That's a large workforce. It was transferred from a community-based model, which I still believe in, and I think I was the lone voice in my own government that had an alternate point of view. But they were all absorbed into a government cadre of workers in our 2008 to 2013 tenure. I think that sort of cut at the very core of the concept of a community-based worker. But nevertheless, now they're all government-paid servants. So it's very difficult to remove anyone for low performance, because in government, performance की तो कोई accountability है ही नहीं ना. आप बैठे रहे, आप सेक्रेटरी हैं, आप डीजी हैं, आप असिस्टेंट सेक्रेटरी हैं, स्पेशल सेक्रेटरी हैं, जो भी हैं, एडिशनल सेक्रेटरी हैं, काम करें ना करें, डिलीवर करें ना करें, आपका तो करियर चलता जाता है.
बिल्कुल. और जजेस प्रोटेक्ट भी करते हैं.
तो ये लेडी हेल्थ वर्कर्स सारी अब गवर्नमेंट एम्प्लॉइज हो गई हैं. अब वो इंटरेस्टेड है कि हमारी प्रमोशंस हो, हमारी सैलरी इंक्रीजेस हो, हमें ये हेल्थ बेनिफिट्स मिले वगैरह वगैरह. So, Bahrain, it is still the largest program. It needs improvement through better training and maybe multi-layering the lady health worker. That's possible. It really needs to be done now, so that she can deliver certain family planning, certainly awareness sessions. That's one of her big jobs. You know, when we started it, Dr. Nadeem, the program was not called Lady Health Workers. That was the common name that it was given. Right. It was called Prime Minister's Program for Family Planning and Primary Health Care. It was a very long title. But family planning was first and primary health care was second. I still believe in it. उसके बाद community midwives बनी, उनके cadres बने, उनकी training हुई है, और community based और health workers आए हैं, community health worker भी आ चुके हैं, और non governmental organizations ने भी ये model लेकर adapt किया है. मारवी worker है सिंध में. So I think that's a very good initiative. Still there. It can be much more productive. It's an essential service to be provided. Now, why can't the lady health worker also do? She shouldn't do too many things. She's asked to do election duties or पता नहीं क्या कुछ भी इसकी जिम्मेदारी डाल देते हैं. लेकिन she's a key agent for social change. Right. So you can have a basic community cadre of educators who mobilize for education. It's not very difficult to do that.
But yeah, how should the system evolve? Two things. A, how is it working? I mean, ठीक है वो जो हो गया है कि उनको grades दे दिए हैं. A, how is it working? And B, how should it evolve?
How should the lady health workers think? I'm sorry, your voice is not clear.
Oh, sorry. I'm saying A, how should this system be evaluated? Has it been evaluated? And
Yeah,
B, how should it? Achha, they have been evaluated, and what's the evaluation?
Third-party evaluations. TPVs हुई हैं, third-party TPEs, third-party evaluations हुई हैं, and they've revealed a lot of very, very significant information. So 3-4 things that need to be done, which are very critical. That continuous training of lady health workers on delivering family planning information, and a certain level of services, referral services in pregnancy cases, information about child health, child nutrition, and family planning practices to be adopted. So, you know, in family planning, I mean, the pill is not reliable at all. Pakistan doesn't, we don't believe in it, because how can you give a certain stock of a month and be sure that it has actually been taken? So, you know, this old-fashioned stuff, giving family planning pills to millions of women out there that are in remote areas and are uneducated. So the latest family planning methodology, it used to be the implant, and now it is the injectable. So the injectable training cannot yet be given to lady health workers, but the lady health workers connected to a system of lady health supervisors. And if it is properly resourced, then injectable training is taking place. And so this should be the next level. If you can reduce the family size through family planning, then you can get much better, you know, rate of return from healthier children, children going to school, children staying in school, and healthier mothers. All of this comes together in a bundle. So if you don't have health attended to, primary health concerns, you will not get kids staying in school. and not able to learn. So, this is all part of
Very
it.
good point. Very good point. Ajay, यहाँ से चले फिर let's go to BISP. So you have, mashallah, contributed to education and very creditably, Lady Health Workers, a great program. I've dealt with it, heard with it, etc. It's a great program. Everybody praises it. What about BISP? Then you got involved with BISP and you raised the BISP. Now tell us what you thought of BISP and where has it gone to? Because I don't know, did you want it to be like a giveaway forever, or did you feel that it was slightly different, a safety net where people could come and go and continue with their lives, or should they remain in there? Because right now BISP seems to be keeping people in it forever.
Dr. Nadeem, thank you for putting BISP on our discussion agenda. And I'm very conscious of the fact that in SIA, you have a lot of very eminent people. I'm not an economist. I sort of call myself a social development person, fundamentally an educationist, but having done a lot of work in healthcare and women and family planning. So the history around BISP is also very much like the history of the lady health workers. So in the period of 90 to 93, when we worked for the next election, and again it's reflected in the manifesto of that time, there were several other things in the social sectors that were included, of which, of course, lady health worker stands out the most. But we also did iodized salt and we did other things. Now, for BISP, Bibi addressed a conference before her Shahadat in December in Islamabad, where she, I think it was earlier than December, where she presented the manifesto for the elections. And we had worked on this whole design of a social protection program. And we had been discussing it for 2-3 years prior to the 2008 elections. Because as you know, before that, General Musharraf had taken over and was president. Hybrid models that we always have to go through. But it was quite clear that she intended to return. It was very clear that she wanted to come back with a powerful agenda of social change. Powerful agenda for delivery to the people. And very much in all her tenures, her eye was very much on education, health, family planning. So we looked at poverty, we looked at dependency, we looked at family size, income levels, and so forth. And I definitely want to say that the key person who brought a lot of this knowledge together was Dr. Kesar Bingwal. I was, of course, a member of the working groups. And I used to go to Dubai. Dr. Kesar also went to Dubai. And we discussed what do we do about poverty numbers. So let me say at the outset, this is not a poverty alleviation program. And there were very intensive discussions at that time. It was a social net, is a social protection program, which is different from a poverty alleviation or poverty eradication program. So एक तो ये जो misconception है कि BISP को billions देते जाओ and poverty will reduce. Well, it's shown over so many years it hasn't. Poverty today is at a staggering increase, more, I think 44%, according to the new poverty line data that they used, World Bank used, which is $4.25 per day per person. So, of course, you can say that doesn't apply and therefore the numbers are larger. That's another discussion. But the numbers are too large for Pakistan still. How can you move into an economic model, manufacturing sector, services sector, and anything else to deliver Pakistan and move Pakistan up in terms of a more stable, more developed, more productive nation until you look at what you do about this mass of people living below the poverty line. So हमने इसके ऊपर बहुत बहस की, study किया, फिर social net program आया था, social protection. There's a little bit of difference, but essentially it's in that category. And we worked on the numbers. And so that's where BISP came from. And at that time, the idea was to provide a certain level of income to the poorest family households. How did we arrive at that 1,200 rupees that we gave out on the first tranche? This was based on an approximate average number of 5 persons per household, and the cost of atta, of flour. That was the basic premise on which we finally said, okay, let's at least come down. It was very, very basic. I wish we had been able to do more. But that's where that number of 1,200 rupees or so came from. Or uske baad ye increase hota gaya. Maybe it could have been a better, criteria. I'm just giving you the history of it. Uske baad BISP ne kya karna tha? Identifying, and this is full credit to Mr. Asif Zardari, full credit there. He said it is going to be the woman who will be the recipient of BISP. No male will receive BISP cash transfers. Long discussion on conditional cash transfers and cash transfers. I think we felt, at least I certainly did, that we should make it a conditional cash transfer. But because we wanted to go to scale, it's very difficult to monitor a CCT. So we went for CT. And it was never supposed to alleviate poverty. How can just 1,200 rupees into a household with 5, 6, 7 family members alleviate poverty? But it should have graduated to the next level. And the next level was give them a higher net income, cash transfer, but combine it with microcredit and skill sets so that the woman becomes part of the economic has an economic status, an income earning status. Of course, that wouldn't have happened with just a couple of 100 rupees, and skill sets of training for income earning activities is still not widespread enough in Pakistan. Lekin microfinance system ka kafi wide net hai. And we had hoped to connect BISP with the microfinance so that these should in partnership deliver to the same woman. And they could have been, and there was a formula that we were working on, we had worked on, and I think hopefully at some point you will interview Kesa Bengali on it, and he will tell you much more of the work that was done. But I'm just talking about the wider model, and this was something I worked on very, very closely with them. So I think the features for BISP were just right. My own sense is that BISP is proliferated into many other programs. They do Wasila Haq, they do Wasila Talim, they do Wasila Rozgar, और वो बड़ा problematic होता जा रहा है क्योंकि Wasila Haq, Wasila Talim, Wasila Rozgar, these are close to the ground level. They've got to be at the provincial level. The BISPs of the provinces have to be strengthened. The federal BISP is it's too far away. It's a huge bureaucracy in there. It doesn't need to be. Actually, these should be well-established BISPs in the province. Now, of course, the Chief Minister of Punjab has brought her own model of BISP to Punjab. Sindh is also doing it. So I think it's really time for a major review and a structural decentralization of BISP and refining it to address primary things such as increase the household income a bit and make them, skill them so that they can go to a microfinance, get microcredit, and not move totally out of poverty straight away, but at least take the first step to becoming a little bit more income. I mean, giving the household a little bit more income. So BISP basic जो था ना उसका ये design नहीं था जो कि ये अब बन गया है. But it is still a powerful instrument. Social nets and social protections have worked in many, many countries to do certain things. And that's what we need to do.
But there has to be graduation, and there has to be some understanding कि ये लोग जाएंगे कहाँ बाद में. देखें जो the way I look at social protection is really it's like a net. जो trapeze artists ऊपर नहीं होते थे, वो net नीचे होता है तो वो गिर जाएंगे फिर ऊपर उठ के trapeze पे चले जाएंगे. बट हमारे यहाँ तो बन गया नेट में बैठे रहे और ऊपर ना जाएं फिर दोबारा. I mean, life is a trapeze game that we fall and we rise up and we do things. So I think that element is kind of missing, and these people have now been in the BSP for over 20 years and they're never going to graduate. So that's one thing. The other thing is, World Bank का poverty scorecard आ गया है और ये जो चीजें आ गई ये, did you envisage that, or this is just the World Bank taking over eventually?
Yes, I absolutely agree with you. We had graduation design, absolutely the design. So I think a lot of things happen when you come out with new initiatives, like I told you with the lady health workers. What was it designed to do, and how should it have been managed? It should have been a community-based worker model, so that the community owned it. It was useful enough for them, and the government did not have to adopt and absorb such a huge payroll, and then deal with pensions and retirements and promotions and things like that. So the original model is, of course, review karne ki zarurat hai, test the ground reality of how it's been run. But I think there was a lot of rationale behind the original model for initiative and also for BISP. But I know it's not going to happen. What's happening is, I don't know what the latest allocation in the budget is, but it's a large allocation.
It's very large allocation.
160 or 180 billion, something like that.
No, it's much more. It's 700 billion or something.
Sorry, 770 billion or so. Yeah. So, gosh, if that's going to go into BSP, and they've got a Wasila Haq, a component, and a Wasila Talim component, and a component, and Wasila Sehat, तो फिर ये तो आपके एजुकेशन सेक्टर बजट से बहुत ज्यादा है। अगर आपने तालीम डिलीवर करनी है और तालीम को इंसेंटिवाइज करना है और स्टाइपेंड्स देने, इंफ्रास्ट्रक्चर बीआईएसपी के पास तो नहीं है ना ये करने के लिए।
जो आपने बड़ी मजार बात की, जो आपने कहा था कि there has to be a coordinated approach. I think where we fail is we can't coordinate. People make their separate silos and sit in those silos, and they think, yeah, my empire is, I have to preserve my empire and I can't coordinate. And I think the coordination is the most important thing, that all these efforts should be coordinated. Perhaps they're best coordinated at the local level and not at the federal level. But the BISP should actually, federal government can give a stipend. They can pass on money. Just America, they give grants to the for social security to the states, and states pass them on to the communities. That's how it works. And I think this is how it should work here rather than a federal bureaucracy. Unfortunately, that won't happen. So let's come to the other element that you put in place. You put in place the Philanthropy Commission. What is the rationale behind that, and what does that do?
The Pakistan Center for Philanthropy?
Yeah.
This happened in 2002. I was working with the World Bank as their senior education specialist, and John Ward was the head of the World Bank at that time. And I was very actively involved with the World Bank program, so I didn't even then believe that we were doing them right and that we were actually modeling the right thing. And, decades of World Bank assistance and other assistance has shown that it really hasn't made a difference in the outcomes and the results. And so we've really got to do this development thing completely differently, not just do it by outside consultants and big time agencies coming in. But anyway, we were working on SAP2 and on a couple of other initiatives. We were looking actually at the quality indicators much more than at access and retention and so forth. When we were also looking at things like curriculum and teacher training. So उस वक्त ये हुआ कि मुझे Dr. Shams Qasim Lakha, who was the president of Yahya Khan University, approached me, and Sayyid Babar Ali Saab. And they gave me a call, and I was really very honored and privileged to receive a call from Sayyid Babar Ali, because I think of him as an icon. In my mind, he's one of the top figures of Pakistan. People who contributed phenomenally, and what an amazing, amazing man, what he's done and how he thinks. And so they said, why don't you come and have lunch with us or something? And Moin Afzal Saab was there too. He was Secretary Finance. So these were the 2 or 3 people. And they said, we're thinking of setting up a center to promote philanthropy. So honestly, Nadeem, I was saying, I work in the education and health sectors. How is it connected to philanthropy? I'm not an expert in philanthropy. I have not studied the field, and I think I'm not the right person. I'm abbreviating the conversation. But they said, no, think about it. And, we want to do something which is different and interesting. And here's a report. And David Bonbright had produced that first report on philanthropy at that time. And why don't you read it about it? Because philanthropy means people and institutions dedicating their money for things that are in the area of public and social good. So philanthropy is supporting clinics and dispensaries and hospitals and schools, etc. And we want to do something that would make it more effective, more credible, and expand philanthropy. Even then, I was a bit at sea, and I said, okay, I'm not sure. I went back to my work and a couple of weeks later, I got a call again. And my own executive director of the World Bank, John Ball, also had a discussion with me. And he said, you're doing a very good job here at the bank, but then you're just part of a larger system. And of course, I felt I was a little cog in that big machinery of the World Bank. And the prescriptions come from headquarters and other consultants, etc. So I did feel that I was losing touch with the reality, and I didn't feel that I was getting anything from the effort that one was putting into it. Not me. The bank program. So he said, there's an opportunity. Why don't you think about it? So we had another meeting. So the Pakistan Center for Philanthropy was their idea. Dr. Shams Qasim Lakha, Moin Afzal, Syed Babar Ali. In the early years, they'd contacted Dr. Atiya Inayatullah as well. And one or two other people, but this was the core team. And they said, look, why don't we sit down and talk? And I then agreed. And I gave up my World Bank position and took the big deep dive, so to speak. So what is it all about? Really, it was about the fact that let's promote philanthropy for development. Because there's a real need to support, mobilize, and harness the resources that flow from philanthropy so that they can be more effective in delivering what all the national aspirations are. That is to say, if somebody is supporting a school, is that philanthropic organization a credible organization? And can people give it more money to support more good schools in the area? So what is the work that they're doing? How credible are they? What is their integrity, financial discipline, etc.? So that's the model. It was for promoting philanthropy for development. And the organizations that are engaging in philanthropy are different types. आपको पता है ना, personal philanthropic foundations होती हैं, बड़ी-बड़ी families हैं जिन्होंने foundation set up की हैं, वो dispensary support कर रहे होते हैं, बहुत सारी चीजें support कर रहे होते हैं, schools बनाए हैं, जैसे डॉक्टर सईद ने हमदर्द यूनिवर्सिटी बनाई थी, प्रोफेसर जो डॉक्टर हकीम सईद साहब थे, इसी तरह पूरे पाकिस्तान में बहुत सारे मॉडल्स हैं. So out of that, and I worked very hard, and I just had one or two people in the beginning. And I must compliment some of the young officers who took leave from the government and came and worked with me. And they were very bright officers, 3-4 of them. And so the model is before you today. It's a certification model. So if you want to say you really are non-profit, are you following the best practices in governance, in financial discipline, in transparency, and an effective program delivery? That's what the PCP certification does. And once you get that stamp, then FPR agreed that anybody donating to organizations run by a certified NGO or promoted through the philanthropy of a certified NGO, that person would get a tax exemption. So ye ek incentive tha to people to give to good non-profit organizations so that they can effectively deliver outcomes for social good and public good. Essentially, that's the model. So we developed that certification model, which is still functional. And I think today there are more than, I think close to about 1,200 or 1,300 organizations across Pakistan that are certified to be clean, transparent, effective, well-governed organizations to whom people do donate. The corporate sector donates, individuals donate, and they all get tax exemptions. And it's recognized by the FPR. So that was the PCP model. It was to promote society's resources through a credible arrangement for delivering exactly, frankly, what the state should be delivering. Health services, education services, water, कोई पानी deliver कर रहा है, कोई housing कर रहा है, और इस किस्म की basic social service needs deliver कर रहे हैं. Very effective organization, extremely competently led by Shazia Amjad, who's now the executive director. I was there for 8 years as the founding executive director, and I left in 2007 because Madrasa Benazir had given me a reserved seat for women for Parliament. That's how I became an MNA for the second time. It's still led by a wonderful board. Mr. Zafar Khan is the chair, and they're outstanding board members.
But do we need a licensing body for philanthropy?
It is. PCP is the licensing body.
That's what I'm saying. So do we need a licensing body for philanthropy?
We need it. Okay. Why do we need it? I think we do need it. One can say that maybe the model, the way you look at a certified organization is appropriate or not. The reason why we need it is because a lot of people do give. But we know that a lot of nonprofits and NGOs get registered by the thousands. There are over, I don't know how many, 200,000 organizations across Pakistan. Not all of them are clean, clear, and transparent. They do have certain other agendas. So money is flowing through these organizations and doing things that maybe are not for the good of the people. And also, there's no public information about them. So if anybody wants to give to a nonprofit, how do they know that that nonprofit is actually doing a good job? So I think like you have ISO 9000, right? Certified for goods, equipment, all sorts of things. Like accountants, chartered accountants come in and do your audit. So do you need anybody to do an audit? Do you need internal auditors? It's sort of like an audit that you're doing with an organization to show the public that, yes, they have met basic good practices. And and this is not a permanent certification. You've got to get it reviewed annually or some, and now they move to every 2 years and every 3 years. So that doesn't mean that you can't give to anybody. Of course you can. And of course there are lots of people who still give to non-PCP certified organizations, but they don't get a tax exemption. So it's a way, Dr. Nadeem, of getting money flowing from private sector to organizations that are actually performing the role of what government should do, provide basic social services. And you get a tax rebate on it.
Right. But I think the thing is, what I worry about is that we've got far too much licensing in this country and far too much certification in this country. I did a report on this in the PID when I was there. Almost every government department, there are 142 regulatory bodies, 122 regulatory bodies in Islamabad. So, and they're all asking for certification fees. And they're all getting, for example, now, most interesting thing is, there's a health regulatory agency that is coming up that wants to charge us 2 rupees on every prescription that we get, right? Now, okay, fair enough, 2 rupees is not a lot, but still, why do we need that certification? PEMRA and NEPRA already do this, and they've got huge funds that they collect because they give you licenses. And what happens is that this licensing slows down the work. And they want regular renewal of licenses with the result that the whole economy is slowing down. So do we need more licensing or less licensing?
No, I agree with you. I'm not in favor of constructing structures that are overlapping. The multiplicity of organizations which we have in Pakistan, we really need to cut down a lot. There needs to be some sort of an audit of functions. And I would not at all propose that you should have multiple organizations breathing down the necks of the same institutions or organizations or individuals. Definitely not. But I don't know of another organization that does a certification of a non-profit the way PCP does it. There may be something.
Why should it be an annual certification? What's going to change in a year? Why shouldn't it be a 5-year or 10-year certification?
Well, it's in the model that you can first start with the 1 year, and then the teams visit the organizations, they go into a lot of detail. They look at your account books, they go and see If you're running a hospital, they'll go to the hospital, they'll see the services, they'll talk to the patients, etc., etc. सारा कुछ देखते हैं, board की governance देखते हैं. So yes, I think that after 1 year, they just come back and they say, okay, these are the 2-3 things, we're fine. You can be certified for 2 years. They've given 3-year certifications, and also there's a table, there's a schedule 1 and 2 to the finance bill, and you can get onto that table 1 or table 2. But now I believe the finance minister is doing away with it, with them all. This is the rumor in the market. So I don't know what's going to happen.
Why is he doing away with it?
You see, I believe the IMF is saying no more special categories, no exemptions, no special categories of organizations that will not be taxed, or they will not be, that will give rebates and so on and so forth. So I believe what they're saying in non-profits, because non-profit tax nahi hote na, a genuine EAD used to do this work. Frankly, EAD would look at non-profits. If any organization wanted to fund a non-profit from outside, they would look at a non-profit here. That's why you remember the time when EAD, I think, cancelled the licenses and the status of hundreds of NGOs.
Save the Children, many organizations.
So I think that there should be a period, not as short as 1 year, but 2 साल. ये सारा मॉडल में है. ये 3 साल की भी सर्टिफिकेशन दे सकते हैं, 5 साल की, लेकिन पहले 1 साल की होती है.
Right. Well, Shahnaz, thank you very much. That's a wonderful life lived. MashaAllah, you've contributed a lot. And MashaAllah, we can truly say that you've affected the development of this country. And that's what I wanted to highlight. And I keep telling my students that these organizations, these need research. So quite frankly, I would like to encourage our students to go out and research these organizations. There's not enough research done on these issues. And if we do, we can improve the model. I mean, you've got the education model, you've got the lady health workers model, you've got the BISP model, and you've got the PCP model. Now, a lot of work has been done on BISP, but we need to encourage our researchers to go ahead and look at these places more, develop more ideas. And I'll ask all the listeners here, if any of you want to research these things, please begin by talking to Shahnaz. She knows a lot about these things. She's initiated these things. And for that, we salute you, Shahnaz Bibi. Thank you very much. And inshallah, we'll do this again. And I'll get hold of Casa Bengali too. And
I do, yeah. We didn't talk about higher education, but I'm sure you have a lot of people to talk about higher education. And Dr. Salaries is one of the best, I think, analysts. And
okay, please tell me. Let's not close right now. Let's quickly, if you have the time.
I think this
is about higher education.
Taken a long time already.
I know. We'll divide it into 2. Tell us about your views on higher education. What do you want? Okay, we'll do it
another occasion, because I think it's a whole area of discussion.
It's a very different area. Agreed. Okay. Thank you very much.
You can have Dr. Faisal Bari and one or two.
I'll do that. I'll do that. Okay. Great. Thank you, Shahnaz Bibi. All the best.
Thank you, Doctor. Thank you very much.